The Department of Health is still tracking down passengers of the Abu Dhabi flight that landed on April 15, even after the 14-day incubation period of the Middle East Respiratory Syndrome coronavirus. The Health Department did say the country remains MERS-CoV free. Pia Banalos has that story.
The Department of Health is not about to stop tracking down all passengers of the Abu Dhabi flight with a Filipino nurse who initially tested positive for Middle East Respiratory Syndrome coronavirus. The search is on despite the fact that the period from infection to showing signs of symptoms, an incubation period of 14 days, has already lapsed. DOH Infectious Disease Manager Dr. Lyndon Lee Sui says authorities have so far tracked down 97% of passengers. So far, 394 have been tested for MERS-CoV, with 371 results already out, all with negative results. Lisoy says there is no reason for the health department to be complacent, as there is always the MERS-CoV threat.
Yung 10 na remaining na tinatrack natin, ang sample na lang nito is kunwari nalaman, pinuntahan namin sa isang bahay. Just to give you an idea on how hard it is, sample, kunwari pinuntahan siya sa Cebu, ang bahay niya is isang bahay sa Cebu, pag pinuntahan doon, nasa Iligan na pala.
The DOH is working closely with the Labor Department in tracking down all passengers of the flight and in advising Filipinos working in the Middle East. There are currently 3 Filipino nurses in Saudi Arabia who tested positive for MERS-CoV. One is in the intensive care unit, the other showing MERS-CoV symptoms, and the last is asymptomatic. Overseas Filipino workers from the Middle East who want to go back to the Philippines are required by the Labor Department to secure exit clearances before traveling.
Yun ang naging problema natin with the 417 passengers who arrived last April 15. Karamihan ho sa kanila ay hindi namin matrack down kasi wala silang contact numbers.
Despite reports of MERS-CoV infection, the Labor Department says the number of workers who seek to work in the Middle East is steady.
Although yung nanggaling doon, sinabi naman nila na hindi naman ganun ka scary yung sitwasyon, hindi naman talaga pinag-uusapan doon. Kaya yung mga nandito, ina-advise nila na go ahead, pwede naman kayong pumunta dito at wala namang ganung problema. Pero ganun pa man, dahil sinasabi nga ng ating health authorities na kailangan mag-ingat, nagbibigay nga tayo ng information sa kanila bago pa umalis kung paano sila makaiwas dito sa virus na ito.
Dimzon says all overseas Filipino workers about to leave for the Middle East have to take a pre-departure orientation seminar informing them about MERS-CoV.
Huwag ninyong ipagpalang bahala kasi mahirap pag kayo dinapuan at ando doon, you can never tell na baka mamaya may spread na talaga yung virus. So pag-iingat ang talagang ini-impress namin sa kanila.
Lisoy stresses there is no shame in being tested for MERS-CoV.
Mas nakakahiya kung alam mo pa ikaw magkakalat ng problema. Di ba? Mas nakakahiya yon. Yung hindi ka nag-cooperate, alam mong isa ka dapat sa ma-examine, alam mong dapat ma-establish na negative ka. Dahil habang hindi ka nagpapa-examine, hindi ka nagpapakita, mas nakakahiya pag at the end of the day, ikaw ang maging dahilan ng pagkalat ng sakit sa community.
He adds PhilHealth will soon come out with a package that would cover the test and hospitalization of suspected MERS-CoV cases. Pia Banalos, Solar News.